vastus femoris. The origin is at the anterior inferior iliac spine. The insertion is in the base of the patella to form the more central portion of the quadriceps femoris tendon, and the nerve supply is in the femoral nerve. And the action is extend the knee and flex the hip. Next is vastus lateralis. The origin is in the upper end and shaft of the femur. The insertion is in quadriceps tendon into the patellae, which passes through the ligamentum patellae into the tubercle of tibia. The nerve supply is in femoral nerve. Next is vastus intermedius. The origin is at the anterior and lateral surface of the shaft of femur. The insertion is in quadriceps tendon into the patella, which passes through the ligamentum patella into the tubercle of tibia. And the nerve supply is in the femoral nerve. Next is vastus medialis. The origin is in the upper end and shaft of the femur. The insertion is in the quadriceps tendon into the patella, which passes through the ligamentum patella into the tubercle of the tibia. And the nerve supply is in the femoral nerve. And the action is extend the leg at knee joint and stabilize the patella. Next is sartorius. The origin is in the anterior superior iliac spine. The insertion is in the upper medial surface of the shaft of the tibia, and the nerve supply is in the femoral nerve. And the action is flex, abduct, and lateral rotate of the hip. Semitendinosus. The origin is at the ischial tuberosity. The insertion is at the upper part of the medial surface of the tibia, and the nerve supply is sciatic nerve. Next is semimembranosus. The origin is at ischial tuberosity. The insertion is at medial condyle of tibia, and the nerve supply is sciatic nerve. Next is biceps femoris. The origin is at the ischial tuberosity. The insertion is at head of the fibula, and the nerve supply is sciatic nerve. The action is flex and medial rotates the leg at knee joint and extend tight at hip joint. Next is adductor magnus. The origin is at the ischial ramus and ischial tuberosity, and the insertion is adductor tubercle of the medial condyle of the femur. And the nerve supply is obturator nerve and sciatic nerve. Action: adduct the thigh at hip joint and assist in lateral rotation and extend the thigh at hip joint. Next is gracilis. The origin is inferior ramus of pubis and ramus of ischium. The insertion is upper part of medial surface of shaft of tibia. The nerve supply is obturator nerve. And the action is adduct the thigh at hip joint and flex the leg at knee joint. Next is gastrocnemius. The origin is medial and lateral condyle of femur. The insertion is posterior calcaneus. The nerve supply is tibial nerve. The action is plantar flex the foot and flex the knee joint. Next is soleus. The origin is shaft of the tibia and fibula. The insertion is via the tendon calcaneus into the posterior surface of the calcaneus, and the nerve supply is tibial nerve. And the action is plantar flexor of ankle joint. Next is plantaris. Origin at lateral supracondylar ridge of the femur. Insertion at posterior surface of the calcaneus. Nerve supply at tibial nerve. And the action is plantar flex the foot at ankle joint and flex the knee joint. Next is popliteus. Origin at lateral condyle of femur. Insertion at posteriorly on medial condyle of tibia. Nerve supply at tibial nerve. And the action is flexion of the knee. Next is peroneus longus. Origin at head of fibula. Insertion is first metatarsal base, and the nerve supply is superficial peroneal nerve. And the action is everse the foot or plantar flex the foot at ankle joint. Peroneus brevis. Origin at lateral surface of the shaft of fibula. Insertion is base of the fifth metatarsal bone, and the nerve supply is superficial peroneal nerve. And the action is everse the foot and plantar flex the foot at the ankle joint. Next is tibialis anterior. Origin at lateral surface of the shaft of tibia and interosseous membrane. Insertion at medial cuneiform and base of the first metatarsal bone. Nerve supply at deep peroneal nerve. And the action is ankle dorsiflexion and extend the foot at the ankle joint. Next is tibialis posterior. Origin at posterior surface of the shaft of tibia and fibula and interosseous membrane. Insertion at tuberosity of the navicular bone and the other neighboring bones. Nerve supply at the tibial nerve. And the action is plantar flexion at the ankle joint and innervation of the foot. Next is peroneus tertius. Origin at anterior surface of the shaft of fibula. Insertion at the base of fifth metatarsal, and the nerve supply is deep peroneal nerve. And the action is dorsiflexion and eversion of foot. Next is extensor digitorum longus. Origin at anterior surface of the shaft of fibula. Insertion at extensor expansion of the lateral four toes. And the nerve supply is deep peroneal nerve. And the action is extend the toes, extend the foot at the ankle joint. Next is extensor digitorum brevis. Origin at calcaneum. Insertion by four tendons into the proximal phalanx of big toe and long extensor tendons to second, third, and fourth toes. Nerve supply at deep peroneal nerve. And the action is extend the big toe, extend the gout of ankle joint, inverts the foot at subtalar and transverse tarsal joints. Next is extensor hallucis longus. Origin at anterior surface of the shaft of the fibula. Insertion base of the distal phalanx of the great toe. And the nerve supply is deep peroneal nerve. And the action is extend the big toe, extend the foot at the ankle joint, inverse the foot at subtalar and transverse tarsal joint. Next is flexor digitorum longus. Origin at posterior surface of the shaft of the tibia. Insertion base of the distal phalanx of the lateral four toes. Nerve supply is the tibial nerve. And the action is flex the distal phalanx of the lateral four toes, plantar flex foot at the ankle joint. Next is flexor hallucis longus. Origin at the posterior surface of the tibia. Insertion base of the distal phalanx of the big toe, and the nerve supply is the tibial nerve. And the action is flex the distal phalanx of the big toe and plantar flex the foot at the ankle joint.